Good evening, everyone, and welcome to our Committee of the Whole meeting for May 17th, 2021. We are meeting virtually, so if you're joining us, I guess you'll know that. But anyway, at any rate, I'd like to call the meeting to order. Welcome everybody here as well, and ask for a motion to adopt the agenda.
So moved, Mr. Mayor.
Okay, moved by Councillor Roth for the adoption of the agenda. Any additions from council to add to the agenda? Okay, seeing none. Mr. Skrepnik, any changes or any additions to the agenda?
Good evening, Mr. Mayor and members of council. Nothing from administration tonight. Thanks.
Okay, thank you very much. Seeing none, no changes or anything, I'll motion to adopt the agenda, so I'll call the question on the motion. Okay, thank you very much. That's been carried. Okay, moving forward onto our agenda, we are starting off with a presentation from the RCMP under 2A. Mr. Wolanski, could you introduce our special guest?
Thank you, Mr. Mayor and council and public. As council is aware, but for the public, we have our inspector of the RCMP detachment, Mike Locken, who comes several times throughout the year to provide an update on some of the activities and information for council and the public. And with that, I'll turn it over to our inspector, Mike Locken.
Hey, thank you very much, Mr. Wolanski. Inspector, welcome. Always look forward to your reports and the pre-read. Looking forward to the presentation. So go ahead.
Good evening, everyone. Just give me a thumbs up, Mr. Mayor, if you can hear me okay.
Yep, perfect.
Okay, perfect. So I'll just start out with the statistics, and as is on the screen right now is a breakdown of a stat sheet that we have showing January to March. The cutoff didn't come in time to have this in for the meeting until I could have included April, but the stats weren't out in time. I think they're available now. But what I had available then was January to March, and it's a comparison of 2021 to 2020. And so you can see that green arrows are a good thing. Red arrows aren't necessarily a good thing, especially when it comes to serious things like persons crimes. There is an increase of 22% this year over the same period of last year. If you look at the other areas, property crime is down 30%. Other criminal code is down 31%, break and enter is down 61%, theft of motor vehicles down 33%, theft under $5,000 is down 52%. And that's a significant number because it's 101 fewer instances. Sometimes we have a variance in the numbers, but it's a small number of crimes captured under that field. So it doesn't take a lot to move those numbers up and down. But when you have 101 fewer instances, that is significant. So although these are great statistics to see, the thing that I see more telling is a larger snapshot over a greater period of time. Although we can, look at this and say that these look very good from January to March. That's a 3-month span of this year compared to last year. And so there are many things that can be taken into account. So what I like to look at more is the 5-year kind of average. And we don't necessarily need to put it up, but on page 2 of the presentation, it does show the person's offenses in 2017 was at 130, 2018 was 152, 2019 was 137, 2020 was 135, and then 2021 it went to 165. So it was a 22% increase over last year, and generally a 27% increase. Now, the one thing that I will say is that the last year, I think in a lot of areas have been somewhat of an anomaly because of COVID, because of the unique economic situation, additional stressors that people have, employment, closures, more time spent together, cooped up in houses, not being able to, do the things that we would normally do would be additional stressors. So I would, just pure speculation, think that the increase, for example, in assaults this year over last year of 26%, could somewhat be contributed to the current situation that we're finding ourselves in with COVID. Now, when we go down to property crime, those numbers look very good over a 5-year period. In fact, everything with the exception of fraud is down significantly. Break and enters are down 56% over the last 5 years. Theft of motor vehicles are down 70%. Theft over $5,000 down 50%. Theft under $5,000 down 64%. The list goes on, but overall, the average over the last 5 years is a reduction of 44% of property crimes. And taking into account all of criminal code charges that the RCMP has investigated within the city of Spruce Grove, we've seen a reduction over the last 5 years of 36%, or 21% reduction since last year. Now, I could also speculate that a significant downturn in break and enters and thefts of motor vehicles could be attributed to people working from home, more or less opportunity for people to break into houses or to steal cars that are warming up to go to work, things like that. But at the same time, the 5-year average has steadily been declining as well. And so, although I'm not one to pat ourselves on the back too often, I would like to think that it's a combination of the enhanced policing initiatives that have been favored to us by the city, combined with some of the work smarter, not harder projects that we've been contributing in the areas of crime reduction and targeting the people who hurt us the most. Which kind of segues into my next topic of the annual performance plan. And the 3 areas that we came up with in priorities, and typically we're supposed to come up with 2 to 3 areas, which I think address the needs of the detachment and the community as a whole. We're looking at employee wellness, because obviously with COVID, we want to keep our employees happy and healthy. And happy, healthy employees are productive employees engaged with the community. So employee wellness, I won't go too much into that, but that is one of the 3 initiatives we have. The other one is public engagement. During COVID, that has been a little bit of a struggle because we've had to come up with some unique ways of staying engaged with the public outside of our traditional means of meeting face-to-face with people, or coffee with a cop, or simple interactions that we would typically have in person, and the meetings with our different stakeholders. So whether it be Zoom meetings or unique different types of engagement, we do have a number of different initiatives under public engagement. One of them being visibility patrols, and it is always a balance between our next topic on the annual performance plan is crime reduction. It is somewhat of a balance, or to maintain between public perception of visibility and crime reduction, because the 2 are actually 2 different things. The guys and girls of the detachment can be out in the middle of the night working on drug dealers that are closely connected to criminal activity and property crime, and nobody would necessarily see them. But at the same time, the public wants to see us out there and have confidence that we are out there. So we do maintain that balance, I think, of having people out. And we had a lot of success stories, especially in the last while, of that balance, whether it be through the public being engaged through reporting suspicious activity to us, which has resulted in a number of different prolific offenders that have been found in our area up to no good in the middle of the night. It wasn't in the city of Spruce Grove, but April 8th, there was suspicious activity out near Onaway. Somebody reported a suspicious vehicle, and it resulted in the seizure of 2 kilograms of methamphetamine. But just 2 days later, on April the 10th, and you might have seen it in the media, our local drug unit and our crime reduction unit worked on a file that had 4 search warrants take place all on the same day, 1 in the city of Edmonton, 1 in the city of Spruce Grove, and 2 in Stony Plain. And that resulted in one of the biggest seizures of drugs that our detachment has ever seen. It was 11 kilograms of cocaine, 2.5 kilograms of fentanyl, and 8,700 capsules of Atizolam, There were some weapons seized and a bunch of other drugs, hundreds of pounds of buff or cutting agent, small amount of cash. But this was not just low-level dealers. These people were actually producing these, and they were like higher-level distributors. And so to take that out certainly does have an interruption in the organized crime activity, and it's all tied to property crime as well. In terms of resourcing at the detachment, we are sitting fairly well right now. Going into the busiest time typically of the year is our summer months. And as I always say, we have an ebb and flow of resources that go up and down, and you kind of want to hit high tide going into the summer. And I think we've been able to do that again this year. I'm just talking about the City of Spruce Grove positions. Out of those positions, I think we only have two hard vacancies. One is being filled internally through just a switch to our plainclothes unit. And then the other one is open for a competition right now. We have a promotion process in place for sergeants and corporals. And so those positions are expected to be filled in the very near future. Something else that we're working on is the enhanced policing funding that comes from the city. Kevin McGilvery is in the process of doing up the plan, and of course in consultation with Mr. Wolanski to see what the priorities are of the city combined with the priorities of the detachment and the hotspots that are as a result of what our analysts see. So it's a combination of all three. So we will be working on that again. And I think enhanced policing always does have a very positive result, and probably is part of the reason why you see all those green arrows on the downward trend over the last 5 years in the city. The last thing that I'll speak to is COVID, the pandemic. I think everybody's talked about it at length. We're going on 14, 15 months here. Our employees were recently eligible for the vaccine. Just on April 30th, police officers were eligible to receive it. And I know a large number of them have already received the vaccine, at least the first dose. We did, as I mentioned before, have an outbreak at the detachment in December. We were able to maintain service delivery through some proper planning that we had in place for our contingency plans. And frontline service delivery to the public was not affected. Again, with the recent restrictions that came about recently with schools being closed, us, like probably many other businesses and organizations, did have somewhat of a struggle, especially in the area of people with young children who had childcare needs. But we've been working with our employees to, make it workable for them, but also maintain our front counter hours. Those have not been affected at this point, and we still remain open for service to the public with our front counter as well. So I'd just like to thank, regardless of, there's many varying opinions on COVID and masking and everything that's going on in the world right now. So I'd just like to thank, everybody who has been very tolerant and taking that second or that time to count to 10 or take a deep breath and recognize that people are not themselves this year, and that we all have to, take a deep breath and know that tomorrow will be better days, and that there's better days ahead. So that's my presentation, pending any questions from council.
Okay, thank you very much for the presentation, Inspector. I really appreciate seeing the numbers trending in the way they are. I think it speaks a lot to the efforts that you and your team are doing, and as well as the enhanced policing that the city is also providing. So I will open up the floor to my colleagues on council for any questions or comments. I'll start with Councillor Roth and then Councillor McKenzie.
Thank you, Mayor Houston. To Inspector Loken, one of the most common complaints that we seem to get, particularly at this time of year when it worsens, and that is traffic offenses, things like dangerous driving, drag racing, those kinds of things. And a couple of the hotspots seem to be Jennifer Howe Way and Century Road. And it seems to be virtually a a nightly occurrence. So I'm just wondering what kind of enforcement. I know that our own personnel at the city do some enforcement on that as well, but what kind of enforcement takes place amongst your officers in catching those kinds, stopping and catching those kinds of offenders?
Thank you for the question. You're right. This time of the year, we do see, an uptick in people going out and horsing around, for lack of a better term. What we rely on a lot, and I see them almost daily, are reports from the public. As I've said repeatedly, the police are only as good as the public they serve. And, we are out there, but a lot of times, especially being visible in a police car and with cell phones and communication the way that it is right now, it's very easy for us to be seen coming, or to give somebody a heads up that, the police are on their way. So we do rely on the public for, like I said, almost daily. We have reports from different members who've received calls from the public. If they do have problems in their area, certainly call the detachment, because those complaints are certainly acted on. They're sent out to the entire detachment for the members who are working on patrol, and they do focus more attention in those areas at that time. Unfortunately, we don't always see them. We don't always catch them, because when you're living there, you're there 24/7, and you experience it and you hear it. And a lot of times when the police show up, everybody disappears. But we do have some, greater success, obviously, from the public when they report those kind of things. And something that I've brought up before is that now that we are in this big detachment with the traffic unit based out of here, the traffic unit gets those concerns from the public as well. We send those to them as well. Although they don't fall under the umbrella of Parkland Detachment, they certainly do enforcement in the city as well. And I think that we've seen an uptick with them being kind of the epicenter of they don't just do our detachment area, they do a huge zone of the province. But being based out of here, they do, obviously, just by their coming and going, are in this area a lot more than they would be if they were based out of their old location in the west end of Edmonton. So anytime that there are concerns, please call us and let us know. We will increase enforcement in that area.
Okay, thank you for that. And I guess you didn't mention it, but I guess it would be useful too if the resident who sees it is able to get a license plate number, not suggesting that necessarily that could be taken to court, but I think all the information that can be provided to the RCMP is helpful.
Absolutely. And, depending on the comfort level of the public, I know that sometimes they don't want to get involved, but what they report is strictly up to them. If they want to, file a complaint where they've got a license plate number, they can just simply pass that on for information, and then we can follow that up. If they want to be an actual witness and are willing to go to court, depending on what they witness, that if it does meet the elements of an offense, we can certainly get a statement from them and lay a charge based on what they have seen, if they're willing.
Yes. Okay. Thank you for that, Inspector Loken.
Thank you.
Okay, thank you very much, Councillor Roth. Councillor McKenzie.
Yes, thank you, Mr. Mayor, and through you to Inspector Loken. Thank you for this presentation. It's great. I just have a question. I know I work with the Intercity Forum on Social Policy Board, and we're within there's been a lot of talk about a shadow pandemic going on right now with the opioid crisis. And I'm just wondering, while I look at these numbers, and I'm not too sure, like drug enforcement, if somebody were to require medical services and end up at the hospital in a potential, drug overdose, but there's no fatalities, are those numbers showing up in these reports at all?
I would suggest no, not under drugs. They would be assisting in another provincial agency, or depending on what the police's capacity was and what was reported to us. A lot of times, if we're there to assist EMS, they take the lead on that, and we basically go there. A lot of times they stage down the street, and because a lot of times when there is an overdose, it happens in potentially dangerous situations, and we go there to basically clear the scene and make sure that it's stable enough for EMS to come in and render assistance to the person that needs it. I know a lot of people might have an issue with reporting if somebody is potentially cratering due to an overdose or something like that, they might be reluctant to call the police. But of course, their safety and getting them to the hospital is the number one priority. And depending on the situation, any other drug investigation that comes out of that afterward would be secondary. But I can tell you that just off the top of my head, as far as somebody that has gone to the hospital for an overdose, at least in our area, has not resulted in somebody, especially them, being charged for anything to do with drugs.
Okay. So, and that's where I'm just wondering, like, from our region, it's hard to truly know, and, hence the whole shadow pandemic. And I think this is happening behind the scenes a fair amount that we, truly don't know. So, would you say, and if you don't know it, that's fine, but do you believe that there is an increase within our region?
It's really hard for me to say. What I can say is that that drug seizure that I talked about earlier was a significant haul, and we are seeing that more frequently. So I would think that if we are seeing that more frequently, you could either say that we're doing a better job of catching bad guys, or there's just that much more out there of that kind of thing. And some of the concerning things, like the drugs that we're seeing, like the carfentanil and the increase in opioids, like the Atizlam capsules that we found. My understanding is Narcan, naloxone doesn't work on those. If somebody overdoses on them and they're an opioid, like our officers carry naloxone or Narcan, mainly for themselves, but obviously if there's a situation where they're safe and they haven't been exposed and they're waiting on EMS and there's potential for, to save somebody through that means that they would, but that doesn't work on this stuff. So, there is a lot of scary things out there.
Yeah, thank you for that. And that it is a concern of mine, huge within, our region. And hopefully, I've heard some stories, some horrific stories from other areas in the province. And thankfully, right now, I don't think we're, quite as bad as some of the other areas, especially up north. But thank you for your presentation.
Thank you.
Mr. Skrepnik, did you want to weigh in?
Yeah, thank you to you, Mr. Mayor, to Councillor McKenzie. I think some of the information that you might be seeking related to your question could be sought out through Alberta Health Services. I know in my time with health, there was quite a bit of reporting around incidences of overdose and incidents of deaths caused by overdose, etc. And a lot of the different strategies around harm reduction, etc. So I think I'll ask Mr. Wolanski if we can follow up with Alberta Health Services to see if there's some information specific to either the city of Spruce Grove or at least the region. I'm not confident that we could get the level of granularity specific to the city of Spruce Grove, but certainly could see what we can find from Alberta Health Services. And I think that would be more in line with your question tonight.
Any other questions or comments? Councillor Oldham and then Councillor Grilke.
Thanks, Mayor. Through you to Inspector. A few of us attended the Alberta Community Crime Prevention Conference online last week, and there was a really interesting presentation on safer communities and neighborhoods, or also known as SCAN, and the work they're doing in the province. Could you just maybe let us know to what extent are they working in our area, or is that a partnership that's maybe forthcoming if it's not going on? I'd be curious to know our work with them.
SCAN is an entity that's been in existence for some time in Alberta. They used to fall under the Alberta Law Enforcement Response Team, but a few years ago, I think it was about 3 years ago, it went to strictly the province and the sheriffs. And I have recently reached out to the manager of SCAN just to because our drug team is doing some great work, but just to collaborate with him to see if there's anything that we could do to, maybe become a little more effective. And it's my understanding that the SCAN team, what they focus on are problem houses or what some would call flop houses, businesses where, things are frequently happening. I think that in a detachment of our size, typically we don't rely on the SCAN unit as much as, say, very small ones or say the city of Edmonton, a lot of scans work would be in the city of Edmonton, the city of Calgary, some in the city of Red Deer. And there are a few other smaller areas that would see them come out there. But typically, our drug and crime reduction and plainclothes units would deal with the same kind of things that they would. The one thing that SCAN would focus on are these flop houses where there's prolific problems, repeated calls for service, and becoming a real nuisance to the community. And I think that we've done a fairly effective job in, if there is a house in our community that requires some extra attention, that we are providing that attention, and that if there is anything to that we are holding those people accountable, and a lot of times we're seeing it dealt with at a lower level before SCAN would typically have to be engaged. My understanding is there is a criteria that where they would become involved, but certainly, like I said, I have reached out to the manager of SCAN, and we will have a meeting at some point in the future just to see if there's anything that we can be doing collectively better, because we're all on the same team here. So if we can trade some ideas or work together on a project, I'm certainly open to that.
Great, thank you for that explanation. Appreciate it. And that's all I had, Mayor.
Okay, thank you very much, Councillor Oldham. Councillor Wilkie.
Thank you, Mr. Mayor. Inspector, just thank you for all that you and your staff are doing, especially, you put your lives on the line every day, and now you're putting your health on the line. So thank you for all of that. I can't say that enough. My question is it's a really specific question, and it's so probably minute on the scale of things that you have to deal with every day, but it was something that happened to me yesterday and I just didn't know how to deal with it. So I thought I would ask you here tonight. So our neighbor, their garage door was open well past the time that somebody would be awake, and we tried to knock on the door, probably a little tentatively. And because it was after hours for enforcement services, but it didn't feel big enough to call 911, is there an incremental step between the two that I or somebody else could have done in order to mitigate one of your statistics?
I would say yes. Something that, my first recommendation, which it sounds like you did, is to go to your neighbor and approach them, because I think that that's one of the things that greatly helps crime reduction, is when neighbors know each other and they look out for each other, as you have done. And if you see something unusual or out of place, then you act on it. Obviously, never put yourselves in harm's way. If you feel that there's something going on, you would call the police. And in response to your specific question about not being able to get a hold of the neighbor and not calling 911, there is a 24-hour complaint line that is available. That it doesn't go through 911, but there is a 24-hour complaint line that you can call from. It's a local number, like if you just look it up on Google, the Parkland RCMP complaint line. There's the admin line, which is only answered during regular business hours. There's a 24-hour complaint line, and then obviously the any matters of urgency would be 911.
Thank you so much. I will look that up. Thank you.
Mr. Wolanski, want to weigh in?
Yeah, thank you, Mr. Mayor. Through to Councillor Grocke. So just as a point of reference for the community as well, our enforcement services line is a 24/7. It's answered 24/7. And so our enforcement services keep varying hours, and there are different patrols. There's different sometimes programs or initiatives that they're taking at various hours, but they also have a way in which that can be passed on to even our fire crews or the RCMP if it's something. So it is also 24/7. It's always answered, and sometimes we might not be able to, but there's often many times that we can.
Okay, thank you for that clarification. Yeah, I felt like I needed to do something, but didn't want to be so aggressive that I was abruptly waking these older couple up. But I also, like I said, didn't want their garage to be pillaged in the middle of the night. So thank you for all of that, gentlemen.
I hate to say it, but one thing I've done, because I do some night riding sometimes, I do see the odd garage door open. So I do exactly what you said. I ring the doorbell. Sometimes they don't come. And I've actually gone down, which I don't like doing, but I go down, I push enter on their garage door opener, and close their garage for them. I've done that a couple of times, but I usually check and see what kind of golf clubs they have first, just before I close the door. I'm just kidding. But I've done that before too. But anyway, good for you. Good for you looking out for your neighbor. And I think that was one of the things. Councillor Acker, go ahead.
Thank you, Mr. Mayor, and thank you so much, Inspector, for your report. It's mostly good news, and that's fantastic to see. And big congratulations. I think a lot of people are proud to see our detachment out and do that incredible large bust and get those drugs off our streets. So thank you so much for all the efforts. A couple of things that are cropping up that we're getting calls on or we're seeing on Facebook is youth fighting around the skate park, around schools. It seems to be picking up again if they're fight clubs or whatnot. Do you guys and your officers get involved in any of that or come across and educate, or is that something you're starting to see as well?
We do, and if you can see behind me, that black thing there is a police radio. And when I'm not in a meeting like this, I do have it on and listen to what's going on in the detachment for calls for service. And you're right, there has been a number of fights at different locations, usually schoolyards or skate parks, things like that. And I know that we have been working with enforcement services. There has been a couple kind of key players a lot of times that we've been focused on, but we certainly do get called to those, and depending on the situation, there can be a variety of outcomes. Sometimes if it's a consensual fight, then the loser can't file charges of assault against the other person. But depending on how high of level the fight becomes, if it turns into where somebody is seriously hurt, then obviously that's no longer a consensual fight.
Oh, great. I'm just happy to hear you're on that, because I know we're hearing about that. Within your report, I did see that spike in the sexual assaults. And I just had the question, and I think you answered this in previous presentations. When I look at the numbers and I see a certain number of incidents, are some of those done by a repeat offender, that they might be continually doing something with their spouse or partner, that they're not this many sexual assault people within the community? Sometimes it's a repeat offense that's ongoing in a bad relationship. Is that one thing I can take some of these numbers as?
Sometimes, absolutely, it is. And I did see that number, in anticipation of this presentation today. I did go to speak to, again, our domestic violence unit, but unfortunately they were tied up with something today and they weren't available to speak with me. But I know that they have told me in the past that there are a lot of domestic violence relationships that have a large number of our sexual assaults are domestic violence related. And I know that we do take them very seriously. Not only our domestic violence unit specifically looks at those, and we have a unit that specifically deals with domestic violence, but we just last year, we created a sexual assault reviewer position. And so this person has additional training in sexual assault, and they review every sexual assault complaint that comes into the detachment, just to provide that added level of expertise, because we do see those as serious offenses, and we just want to make sure that everything is done properly. And it's not just, it doesn't just end with the police, through our CPVS, the worker that works with us, and then also victim services, we do engage whatever resources the victims need as well, so that it's not just, it doesn't just end with the initial report to the police, that it continues after that to continue supporting them.
Well, that's fantastic. Well, great to hear. Another follow-up question from your previous presentation and just to today. I know we're seeing a lot of repeat offenders, prolific offenders released from jail early because of the courts and everything else. Is this still having a problem here in Spruce Grove? Is this something you're seeing?
It does. I mean, I really can't be critical of any particular system, and namely the judicial system, but I can tell you that it is a core number of people that we do see committing these offenses repeatedly, especially our property crime offenses. We do have our key players that we see repeatedly, and we know that when they are released from jail, that we will be seeing them, and we kind of know the types of crimes that they do and the areas that will be hit. And it's no surprise that the day after they get out, that we see an increase in certain areas of the crimes that they typically do. So that's something that our crime reduction unit does focus on. And there is a district, I think I've spoken about it a couple of years ago. I haven't spoken about it lately, but there is a district crime reduction unit based out of Central Alberta District. And we are working with them right now on a project to kind of target the worst of the worst in our area, because, we can do our part and send them to court and hold them accountable. The rest isn't up to us, but certainly we are doing what we can from our perspective.
Fantastic. And just once again, thank you to you and all the officers for what you do. And I know, especially in today's climate with COVID, it's very polarizing. There's, as you mentioned in some of these stats, tensions are high, stress is high, and I'm sure your officers are facing that on a day-to-day basis. But we really appreciate all the work you're doing and keep up the incredible job of making sure that we're all safe. So thank you.
Thank you.
Okay, thank you very much. Any other questions or comments? Just to follow up, as Councillor Oldham had said, a few of us had attended the Alberta Community Crime Prevention Conference. And one of the ones that kind of stood out to me was, it was called BARC. It's called the Barrhead Regional Crime Coalition. And they have a crime coalition up there with the county and the town and the area up there related to, how they have reporting lines and they have all kinds of systems. And actually, I think they even have a line where the RCMP can do, for people that register, can do a mass kind of a telephone call to warn people of, a violent sexual offender or something that's loose in the area or something. But they had a coalition. Is that something that's taking traction in and around different regions, or is that something that would be explored in the tri-region, one of those coalitions? Or do we already have it?
Yeah, we do. We do have various crime prevention groups and not Crime Stoppers, but crime watch groups in different areas of people that go out with varying levels of success. And I think that especially as of late, a lot of people would rather deal with something on their smartphone than actually physically attending a meeting. And with COVID and the way that the world that we live in right now, a lot of meetings aren't taking place. So something that we've been kind of suggesting to people is this app called Lightcatch. I've spoken about it before, and Lightcatch is an app that people can download on their phone, and it's basically, in a nutshell, kind of an online way of doing that same thing, where people can upload videos, they can upload photos, they can say, be on the lookout for, something like that. And although it's not monitored 24/7 by the detachment, I think most members have it on their phones. And so it does provide us with information. And obviously, if there's any significant information that somebody has to report on there, we still want people to call the police. But it's just a way for people to have their eyes and ears in the community all kind of connected virtually online. And some other things that we're also looking at is a video registry. We've seen a pilot take place in Red Deer, and there are some smaller communities that have that as well. And we were going to put that in place this winter. There was just a couple bugs that needed to be worked out with the registry. And it's strictly, it's completely voluntary that people would sign up for. Doesn't give the police access to your video cameras. What it does is it's simply a registry that, if there's something that's happened at 123 Main Street, then we can go to our registry and see all the CCTV cameras that are registered in that area. And that can be a fairly quick means of us going to find those cameras and then talk to the owners of those to see if they're willing to, look at the footage and either turn it over to us or say if there's anything on there. So, yeah, there are a number of different initiatives that we're looking at.
Great. Thank you for that. One of the key things that they talked about on the crime prevention in communities, and actually they were indicating there's a downward trend pretty much across Alberta and including Western Canada in regards to the crime numbers. But they had 5 things that people could do to reduce their personal crime, which was making sure that they secure all windows and doors, add additional improved locks to garden sheds and to your home, increase lighting around your home, including security and motion detector lighting, check your vehicles and your garage doors and everything every night before you go to bed, and look out for each other. That was one of the 5 things that they, they promoted to, to bring awareness to the community and the impact that it could have. And I think our community is doing that. So, kudos to our community as well, because I think we're all part of the solution. The one thing I did notice, which was kind of surprising, maybe not surprising, I don't know if it was related to the mild winter we had, but our motor vehicle injury accidents were down 58%. That was really significant. We'd only had 19 injury accidents compared to 45 same period last year. Is that because of the mild winter, or is that because of our new enhanced automated traffic enforcement at serious injury accident locations, or a combination of both?
You know what, it could be a combination of those 2 things. And then also, contrary to, kind of how it looks, I know that at certain periods, we're not seeing the traffic on the roads, like the volume that we've seen because of COVID this year. Just like I said, I'm looking out my window right now at 16A, and it does look fairly busy. But I know that there have been some times where you typically would see a lot of traffic, and it's pretty much dead. So I think that would probably have a part of it, and then also environmental factors, depending on the weather that's rolled through and the time of the day. Like I know that if we have seen freezing rain or something like that roll through either at rush hour in the morning or the afternoon commute to or from the city, that can wreak havoc. And so maybe we just got lucky in that area. But I think it's a combination of all those things that you mentioned. As I've said, in a lot of cases, I think this past year has been somewhat of an anomaly with COVID, and so this past year I think will be really tough to. It'll throw a lot of variance into the statistics, and once we get through this pandemic, we'll likely probably see somewhat normal. But I'd also like to think it's from some of the initiatives that the city and us have brought forward. Yeah.
Okay, thanks. The last thing I wanted to say is. Myself personally, and I think I can pretty much speak for everybody, I think I see it as well, but I see an increased visibility with the RCMP in Spruce Grove. I know that we were really happy to see, I think it was the Highway Traffic Unit doing a major operation on Century Road one day, pulling people in for speeding, being visible in the community. I've seen a number of RCMP pulling vehicles over on 16A, as well as even on Jennifer Holloway the other day, ticketing people for speeding. So I really appreciate the visibility out there and stuff in the community, and wanted to thank you for all the work you did. I think I will say this: the big drug bust that your detachment was able to achieve the other day, that saved lives, because the amount of drugs that you guys took off the streets. There's people that were going to die from some of that, with the overdosing and stuff that's going on. But really appreciate the work. I think it's a tip of the iceberg. I think we all need to be vigilant and do more. And then the last thing I want to encourage people in the community to do that are watching is report crime, because we have crime analysts that are trying to monitor this. And let's make sure that you report crime and call it in. And sometimes we can't always have an officer coming there to your home to check on where the bike disappeared to, but at least we have a tracking of that type of crime. But anyway, Inspector, thanks again for the presentation, and thanks for the good news story. And we're happy to see a reduction in crime for sure. Keep up the great work.
Thank you, everyone.
Okay, thank you. Okay, thanks very much. And if I could get a motion to accept the inspector's report for information. Councillor Oldham.
Mr. Mayor, I'll move that the RCMP report be received as information.
Okay, thank you very much. I'll call the question on the motion. Okay, thank you very much. That's been carried. Moving forward, we're going to go into Mr. Wolanski, COVID-19 pandemic update.
Thank you, Mr. Mayor and council and the public. We are seeing a downward trend in our case numbers in Spruce Grove and with our neighbors. So that is certainly good news. Currently, Spruce Grove has 149 active cases. Parkland County has 96 and Stony Plain has 68. As a reminder, the stronger public health measures to stop the spike in cases remain in effect to help protect our healthcare system, which includes indoor gatherings are still prohibited. Outdoor gatherings are limited to 5 people, must follow physical distancing, and may not have an indoor component. Indoor performance, fitness, sport, and recreation activities are not permitted, and outdoor fitness, recreation, and performance activities are prohibited, except with members of your own household or your two close contacts if you live alone. Outdoor recreation facilities can remain open, but are only to be used again with members of your own household or two close contacts if you live alone. And as we've been reporting several times, in-person dining is prohibited, but takeout and curbside pickup and delivery is only allowed at this time. Complete information on these measures can be found at alberta.ca/stopthespike. And as we've seen some trends in our community in a positive sense, then we want to certainly thank the community for doing their part. Last week, the government of Alberta did announce different rules around exemptions from wearing a mask due to medical conditions. Individuals are now required to obtain a medical exemption letter verifying their health condition from an authorized healthcare provider. And this change took effect on the 13th of May. Vaccinations, all Albertans 12 years of age and older can get the COVID-19 vaccine. Information on those vaccines are available on the government of Alberta's website at alberta.ca. But as I've said many times, the link to that website is also found on the city's page. While more and more people are getting vaccinated, it is still critical to continue following all public health guidelines. A new vaccination campaign, Back to Normal, has been launched by the province to emphasize the crucial importance of Albertans getting vaccinated and hopefully leading to sooner rather than later getting back to, quote, normal. The province has announced today that they will be providing statistics on vaccinations by local geographic areas. Currently, the city of Spruce Grove and Stony Plain area are combined right now. It does show that we are 43.2% of those eligible 12 years of age and older have received at least one dose of the vaccine. In comparison to the provincial average, it's at 42.2%, just above for Spruce Grove, Stony Plain. So that's certainly also good news. We do want to remind everyone that when we think of this pandemic, that self-care and mental health is extremely important. If you know someone that is struggling, there are a number of supports available. There are a list of resources at ahs.ca/help-in-tough-times. But the city's website also has a list of locally curated resources and supports at sprucegrove.org/COVID supports. And finally, Mr. Mayor, we want to continue to work together. We cannot do this alone. It is not just you or I or just a few of us. It is certainly a community. We want to encourage people to get vaccinated as soon as you're eligible. Stay 2 meters apart, wear a mask in public places, indoor workplaces, and places of worship. Continue to practice good hygiene at all times, washing your hands, covering coughs and sneezes, monitoring your symptoms every day. And if you're sick in any way, please stay home, get tested, and then follow the mandatory isolation requirements. And probably most importantly, don't forget to be kind and respectful to all of those around you. And with that, Mr. Mayor, I'll answer any questions on this report or any other items on COVID.
Okay, thank you very much, Mr. Wolanski, and thank you for keeping everybody updated and the work that the EMA is doing to, follow the guidelines. And I do believe that we have done an amazing job as a city following Alberta Health Services guidelines. We've done our best to listen to the professionals and stuff, and I think that bodes well with the organization and council to try to follow that. We certainly understand the difficulty and the tough job that the province has. I wouldn't want to be in that position to making those tough decisions, and they are extremely hard decisions. So anyway, I'll thank you for the report. I'll open up the floor to my colleagues on council if there's any questions or comments. Don't see any. I think with the trending, happy to see the numbers trending down a bit. I think we're still uncomfortably a little bit high, I believe, but I think the numbers are trending in the right direction. Happen to see Parkland County's numbers come down dramatically, and hopefully ours will soon follow. But I think the new restrictions are having an impact on the downward trend right across the province. So hopefully the new vaccination program rollout will get us to that nice summer we're all hoping to have a little quicker. Okay, thank you very much for the report. I'll just ask one of my colleagues on council to make a motion to accept your report for information. Councillor Grilke.
Mr. Mayor, I'll move that the COVID-19 pandemic update report be received as information.
Okay, thank you very much, Councillor Grilke. I'll call the question on the motion. Okay, thank you. That's been carried. Moving forward, we have business item, which is the Spruce Grove COVID-19 Recovery Spring 2021 Progress Report. Mrs. Peters is going to be doing the presentation on that. Welcome, Janine.
Thank you, Mr. Mayor. Good evening to you and good evening to members of council. Recovery team is pleased to be here tonight to provide an update on the recovery framework. The last update was provided last fall, focusing on economic and social indicators of community health and the outcome of municipal governance strategies such as tax deferral. At that time, council expressed concern about the overall community and economic health impacts of the pandemic and what additional activities the city could implement to help ease the burden. And the attached progress report informs on those learnings. Next slide, please. Could I have the next slide, please? We seem to be having a bit of a glitch here. Thank you. Well over a year into the pandemic, the city's emergency management agency continues to operate with provincial policy and regulatory requirements informing the strategies and operations of the city. Engagement with economic and community groups continues, and surveys and research are also used to inform and guide our actions supporting residents and businesses. The concept of adaptation continues to drive our learnings, and while we remain focused on the governance, economic, and community pillars within the recovery framework, important themes have emerged. COVID-19 continues to affect all of us, with many inspirational stories of resilience and innovation emerging. However, it is not affecting everyone equally, and we'll talk about some of those differences this evening. Next slide, please. Community resilience is the ability to adapt and shift into new ways of doing and being when things get really tough. It's important for us to identify and understand where the strengths and assets lie within our community and where there may be opportunities for targeted investment for high impact towards recovery. In order to identify those areas, we need to have a really good understanding of the complexities within this highly dynamic environment and be able to work collaboratively. Next slide, please. So what have we learned? Well, obviously, economic and financial stability continues to be a primary foundational focus for recovery. There are signs that overall the business community is demonstrating adaptability, innovation, and resilience. However, different sectors are being impacted in different ways. Retail, personal service, and hospitality sectors have been impacted the most, while the industrial market has remained relatively stable. The residential market is showing strength in new construction starts, improvements, and real estate transactions. And first quarter data indicate that building permit value for 2021 has doubled that of the same period from last year. The average selling price for single detached homes has increased, and the number of sale transactions has more than doubled when compared to the same period last year, and that is good news. Having said that, affordability for many renter households remains a concern, with pre-COVID data indicating 1 in every 5 renter households continuing to experience core housing need, mainly due to affordability challenges. Government programs and funding streams continue to provide critical supports to residents and businesses to get them through. However, longer-term impacts remain uncertain. Next slide. Influences of the pandemic on the mental health of residents are substantive, and as in other areas, impacts will take time to be fully understood. Research indicate that financial stressors and social isolation are the strongest drivers of mental health, and that stable employment and a living wage are central to supporting residents in this area. Pre-existing issues appear to be aggravated as a result of the pandemic. Last July, more opioid deaths were recorded than in any other month in Alberta's history. Suicide-related calls to Alberta crisis centers increased in 2020. However, preliminary data is suggesting that suicide deaths for the year are below average. The full picture of how COVID-19 impacts suicide rates will take time for us to understand. At the other end of the spectrum, the pandemic has also resulted in inspired changes for many residents, such as improved personal relationships and physical health. The ability to maintain social connections in innovative ways is a significant determinant of mental health. Much information on how to access mental health supports and innovative ways to support mental wellness is readily available. However, consistent availability of local data on the health of our own community is limited, and an opportunity exists to build on this collectively to gain more meaningful insight. And I think that reflects back on the conversation with the earlier presentation with Inspector Loken. Next slide, please. Social distancing requirements created the need for even the most resistant to digitize their practices, and what began as frantic improvisation quickly escalated to essential in areas such as remote work, virtual service delivery, online education, and social connectivity. Local businesses and service providers have adapted quickly by pivoting methods utilizing technology, and digital literacy will continue to be an important focus for adaptation on many fronts. When digital becomes essential, digital inclusion becomes a crucial consideration, particularly for vulnerable populations who do not have access to devices or the internet. Elderly and low-income households are particularly at risk due to affordability, accessibility, and gaps in digital literacy. Over the past year, we saw local grassroots activities such as Project Joy and tech drives launched to address some of these needs through provision of laptops and access to free Wi-Fi. Rapid development and launching of technology has elevated the importance of ethics and privacy preservation, key factors in trust building, which directly impacts the viability of any technical solutions for communities. Next slide, please. Community building is very important for recovery. There are approximately 159 nonprofit organizations in Spruce Grove, and many of these organizations play a vital role by providing critical services contributing to the economic and social stability of the community. They often understand better than anyone the needs within the community and the best ways to meet them. Challenges experienced by many of these organizations from operating within the pandemic are not surprising and include mental strain on staff, increased demand for services with lessening capacity, challenges adjusting to technology needs, and difficulty understanding the Alberta Health Operating Guidelines. Despite the challenges, there remains a strong commitment to staying the course expressed through the desire to connect and help others. Knowledge sharing, research, and opportunities to partner in new ways for collective impact have remained stronger than ever, fostering a sense of hope and resilience. Work continues to advance on local issues such as poverty and homelessness with the evolution of Hope and Home and expansion of hours by the Community Winter Emergency Response during the lockdowns. Grassroots initiatives such as Project Joy emerged to support social connections for seniors. Other community-based programs were launched through FCSS recovery grants. The Parkland Region Chamber of Commerce and City Centre Business Associations have emerged with strong, unified voices. Next slide. Our community is strong, and the city has and continues to play an important role supporting resiliency by offering programs specifically targeting COVID recovery, alongside many pre-pandemic activities identified as high-impact areas. For example, helping businesses and individuals navigate the numerous COVID-19 support and recovery programs available through the federal and provincial governments has been instrumental in helping many businesses survive and maintain employment levels. Promotion of Shop Local initiatives, timing of the fiber optic broadband strategy, and the Alberta Red Tape Reduction Initiative all contribute to a positive investment climate coming out of COVID-19. Ongoing targeted programs offering Offerings adapted to virtual platforms supporting the social and wellness needs of residents have been well received. The city has also been providing leadership in bringing community groups together to collectively address social issues. And I mentioned already the winter emergency response, Hope and Home, hosting of the Critical Connections, service provider interagency groups, etc. Other community capacity building activities include disbursement of community grants, addressing food security, and conducting and offering comprehensive research. Environmental stewardship continues to be an important strategy to focus on community health and recovery, and the city is undertaking a number of initiatives to reduce our carbon footprint. Next slide, please. Utilizing an asset-based approach to recovery means building upon work already underway for sustainable change, allowing and providing opportunities for residents and organizations to contribute, and identifying areas where the city can intentionally focus attention and investment for the greatest impact. When community resilience is at work, residents and organizations demonstrate the ability to unite community resources and collaborate to take collective action. Past examples include the city's promotion of Shop Local initiatives as a partner to the business community, and supporting the community winter emergency response as a partner by filling gaps such as providing training for community volunteers, offering food security, communications, and grant support. Moving forward, where possible, we will continue to utilize existing resources and assets to achieve recovery. Next slide, please. Building upon that asset-based approach, the city is currently working on a number of programs and initiatives to support recovery over the short to medium term and sustainably into the future. As you've heard throughout this presentation, digital literacy has become a critical focus on many fronts for successful recovery. And the city is working to bring a digital adoption program targeting local business to support transition to online platforms and increase global competitiveness. Affordable clean energy opportunities for the community are being explored, and activities are being identified, launching from the city's greenhouse gas inventory and analysis findings, which were recently presented to council. Strengthening the internal infrastructure to be able to formalize and expand the scope of community grant opportunities beyond preventative FCSS programs to address both short-term recovery and broader long-term needs of the community is in progress. Administration is also exploring sustainable procurement and will be bringing forward an initial primer document for council's discussion in the future weeks. The attached progress report highlights many other activities the city is undertaking that support recovery. Next slide, please. While there remains a tremendous amount of uncertainty, we continue to pivot between response and recovery and to transition towards sustainable adaptation, utilizing a long-term planning horizon and asset-based approach. Next slide. And that brings us to the end of our presentation, and we are looking forward to hearing thoughts and ideas from council on recovery. But before we open the floor to do that, we are excited to share another initiative that the city's been working on, which is a public communications campaign to highlight local organizations and businesses as our community recovers from the effects of the pandemic. The city is collaborating with a number of different local groups to produce a video series highlighting how resilient and innovative our community is, which is a platform to foster hope and inspiration. We'll be rolling out the campaign over the coming weeks on the city's website and social media accounts. And although not included with the agenda package, we're excited to be able to premiere 2 of these brief videos for you tonight, showcasing tangible real-life examples of local community resilience in action. And we hope you enjoy them.
Talking Dog Brewing is a local microbrewery right here in Spruce Grove. Our business model was that we were going to be a tap room. So we are brewing in the back, really just to fill the tap room in the front. The people are sitting here having a pint, bringing their families in and eating and drinking. That totally changed because we were only open for 4 weeks when the first shutdown really happened. So we could only sell off sales. We went completely to growler and howler fills. And we've learned that that's a huge now part of our business, way more than we ever expected it to be. So much so that we can't even keep the growler bottles on the shelves. We have a single seam canner, and as soon as that first shutdown happened, Paul started to call around and we were looking for cans. We just started canning, so we would spend 5 to 10 hours a week single canning at a time, and then we would make as many as we could do and we would sell them. They would be sold out by the end of the week. We are amazed at the support that we've had. Even though things were unexpected, we like the turn that has taken, and we're still happy with where our business is going.
Seniors in care homes, life looked a lot different when the lockdown began. Before they could take day trips, they could have visitors in, and now they might be confined even to their own bedroom. So very lonely and isolated. My kids were just at home, and we just thought, oh my goodness, we have some old devices at home that we're not even using. And if we have these, then there's probably lots of people that have unused devices. And we got the word out, and very quickly people started donating their unused devices to us. Although COVID brought it to light, it's really a needed thing even past the pandemic. These devices allow them to kind of keep up with life as it is right now. It's changing and it's different for all of us. It's the new normal, but we needed to make a new normal where they were also included. They've been able to see, milestones of their grandkids. Some are meeting grandkids for their first time over Skype or FaceTime. We were able to get Copper Sky 12 devices, and after that, I think we've done 37 homes since, but all started in Spruce Grove, and now we're kind of all over Alberta.
So that is the presentation from the recovery team, and we're looking forward to comments and questions from council.
Okay, thank you very much, Janine. And I couldn't think of a better video for recovery than Talking Dog Brewery if you wanted to, get behind business in the community. I've heard great new business and stuff. So with that, thank you very much for the presentation. I'll open up the floor to my colleagues on council if there's any questions or comments, and I'll start off with Councillor Roth.
Thank you, Mayor Houston. Janine, you mentioned in your presentation that suicide rates are down, and that is actually consistent with my belief. And my question is due to a conversation I had recently with someone who said suicide rates are up dramatically, which I don't think is borne out by the numbers. So to check that, I learned, and this is Canada, but last year we had 3,890 suicides in Canada, and the year before we had 3,811. So that's a marginal change. So, and of course, we're only a third of the way through the year of 2021. So I wonder if you could provide some evidence or some numbers or something that supports the contention that suicide rates are down despite the consequences of the pandemic.
So we have received our information from the Spruce Grove COVID social impacts of COVID reports, and though that would be from research conducted by our team. And I don't have those numbers for you right now, but I can certainly find them for you. How we are interpreting that is that the actual calls to service have increased. Of course, over time, the validity of the numbers are going to change, and more information is going to emerge about how that actually will be interpreted over time.
I'd be interested in those numbers, but not just Spruce Grove, but Alberta-wide too, if you're able to get those to us. Maybe your Googling skills are superior to mine. I don't know. So thank you for that. Thank you, Mayor Houston.
Councillor Acker.
Thank you, Mr. Mayor, and thank you so much, Ms. Peter. I love the report. I think you've hit all the elements that we need to be focused on: economy, the environment, business, people's mental health, poverty issues. You've tackled all the key ideas. The one question I'm seeing amiss, and I think there's going to be a huge demand as we come out of the pandemic into recovery, is a huge sense of the community wanting to get back embraced with the community. And I think the city needs to play a bigger role of facilitating those opportunities of opening up more ad hoc park drop-ins. I think we're just going to have to play a bigger role because there's a pent-up need for reconnections. I think we need to facilitate those reconnections within our community. 14, 15, 16 months of isolation is tough on everyone's mental health.
Mhm.
And it's one thing I think we need to have a little bit more focus on. I know it's kind of specified in here of people getting more involved, and we have a plan for a new re-envision block party project coming up. But it's one piece that I think that we might need to put a little more effort in. But otherwise, I think we're hitting everything out. And I got to say, I love the videos. I can't wait to see what else comes out. And I'm excited to see how the community reacts to those, but positive messaging. And the Project Joy one almost had me in tears. So fantastic job.
Through you, Mr. Mayor, to Councillor Acker, thank you for that feedback. We will take that into consideration in our planning moving forward.
Okay, thank you very much. Councillor Grilke.
Thank you, Mr. Mayor, and through you to Ms. Peter. The Project Joy one actually had me in tears because having a elderly parent who was recently in care and having no concept of how going through COVID would have been, I'm relieved, or I'm happy that there are projects like that going on. So thank you for highlighting that specific project. My question is, with the 159 not-for-profits, and there likely is, and forgive me for not knowing, is there a directory of all of those? And as Councillor Acker said, the reason why I ask is because I think we are going to have a real outreach of people wanting to connect with others and give if they can and be involved and maybe volunteer. And is there, are they cataloged somehow, and is there a list of what they actively are looking for in needs of donations or volunteerism, or is there some sort of thing that people can reference?
Through you, Mr. Mayor, to Councillor Grolke, that's a great question. There is a listing, typically through Service Alberta, just through registered not-for-profits. How they are categorized is very broad. Through our Community Social Development Office, through our Economic Development Office, and other departments, we do have a listing of organizations that typically are connected to serving the community, although you know, how connected they are or closely they're partnering with the city really does vary. But we're always open to accessing different types of community groups, different partnerships. We're always looking for those. We have connections through the community. Definitely an opportunity for our social planning department to expand into and do a call out for sure.
Awesome, and thank you to your group. I'm expressly excited about the social procurement policy, but I agree that all of those other elements are super important, and I look forward to seeing what other businesses and social groups that your committee highlights, and thank you for all the good work that you've been doing. My dogs are wrestling in the background, so I am going to mute myself.
Okay, thank you very much, Councillor Grilke. Councillor McKenzie.
Yes, thank you, Mr. Mayor, through you to Ms. Peters. I get that we have, thank you first off for the presentation. It was fantastic. And yes, the Project Joy did have me in tears too. I was actually sniffling my nose a little bit before I had to come online here. But in terms of mental health, I think that it's great. We have the links, we have, you know, where people can go for help, and we have those resources. But I'm hearing more and more that people are being turned away, or there's wait lists, or they're needing to find their own resources, which a lot of them can't afford. Is there any ways that, you know, we as the city of Spruce Grove, I know working with the Inner City Forum with other municipalities across Alberta, but is there other ways that we can advocate to the province for greater resources, you know, or is it true that these wait lists and that sort of thing is truly an issue?
Yeah, that's a great question. And, pre-pandemic, sorry, through you, Mr. Mayor, to Councillor McKenzie, pre-pandemic environment with respect to mental health, there definitely were many gaps, long wait lists, and, our office did try and fill gaps where possible. Lots of other organizations like Primary Care Network were stepping up to fill some of those gaps and shorten those wait lists as well. I know that the provincial government does have plans to increase investment into mental health and addictions provincially. There are a number of grants available for organizations to increase mental health supports for community. There are a number of programs that have phone-in access. Our office also offers free counseling for eligible residents. And I will stop because I see Mr. Skrepnik is looking to
Go ahead, Mr. Skrepnik.
Yeah, thank you. And certainly didn't mean to cut Ms. Peter off, but I think through you, Mr. Mayor, to Councillor McKenzie, I think what the entire healthcare system is going to see post-pandemic is a substantive backlog in all aspects of services it provides. I think of people on wait lists for knee replacement, hip replacements. The list goes on, and I think mental health is a big category. And I know, the time that I had spent with the ministry, there was, a lot of discussion about sort of the post-pandemic tsunami called, the mental health piece. And, I know that the government, as Ms. Peter has raised, is amping up its investment in mental health. I think what we can do is to try to advocate for as much of that sort of allocation that's, come our way. And, there'll be a lot of competition with the major cities in this regard, but, I think there's ways that we can continue to advocate, and something that I think we can take away and come back with some thoughts on how we can do that. But I think the next significant healthcare crisis is how we come out of the pandemic, and how, there's even people waiting for cardiac care that simply are waiting. And I think that's just indicative of how the pandemic has really placed a huge strain on the healthcare system. But I think mental health is certainly an area that needs great attention. Thanks.
Yes, thank you for that. And I appreciate your background and knowledge on that, Mr. Skrepnik. I just have one further question to through you, Mr. Mayor, to Ms. Peter. Your Spruce Grove Recovers, amazing. What a great concept and a way to highlight our local businesses. Is there a way that people can nominate or get in touch with the city? Because maybe there is some businesses out there that, we're not aware of, or is there a way that our community can, if we know of a business that has done amazing things and is, struggling through, but getting through it, is there a way we can reach out and let the city know?
Through you, Mr. Mayor, to Councillor McKenzie, I am going to ask that Mr. Walker respond to your question.
Through you, Mr. Mayor, this time around, there were a select number of videos done, so we recommended essentially a number of businesses and groups to profile. But if we were looking at doing any additional videos, I mean, it's we can certainly talk to the City Center Business Association, for example, or the chamber to see if there are particular businesses they think should be profiled. This is something that shouldn't be static. I mean, it can be updated periodically, and so it can be refreshed from time to time. So there's probably a real opportunity to reach out and see if there are some businesses out there that as I say, if one of our business associations comes forward and say, this is a business that has really come through the pandemic and has done well, and they've made all the adjustments and so forth that they need to survive, and and so forth. So I mean, I think going forward, there's some opportunity to in fact do that.
Yes, thank you for that. And I struggle with how to say this because out of great things often comes critique. And my worry is I don't want to have a view that the city has only highlighted certain businesses and other people feel that they have done great things and they've been struggling and the city didn't highlight them, and creating an unfair competitiveness between our businesses. So that's why I just ask about how to nominate and that sort of thing. And, I hate to put a negative spin on something that is absolutely amazing and brought me to tears. Not just the Project Joy, but as well as even Talking Dog, and knowing, I've had this dealings with them and knowing what they have struggled through. But I do know that there are other similar businesses in the community. So I just, want to make sure that we are making sure that we're able to capture. And I love that we can keep this going. And, we're not recovering in 5 days. So, it is, if this is something that we can continue and keep growing, I think that's an amazing thing. So thank you.
Yeah, thank you.
Okay, thank you very much, Councillor McKenzie. Any other comments? Councillor Oldham.
Thank you, Mayor, and thanks, Ms. Peter, for your presentation. So much going on. I went back to a recovery framework that we read from you earlier in the fall and tried to find some alignments. And it's great to see how your presentation today really reflects and builds on some of the work that was done in the fall. So really appreciate all the various aspects that your team is tackling, and really supportive. I'd like to reiterate what Councillor Acker had to say about finding ways to connect our community, because I know in so many ways people want to contribute and people want to be part of the solution, but they just oftentimes don't know how. And if we could ever find a way to leverage that energy that people are going to have into doing positive things with some good direction, I think it would be pretty powerful. I know that's not a simple thing to do though. And so I can appreciate how, we need to be careful with that concept as well. I'm curious as to if the uptake or the amount of times that the apps that were referenced previously in our recovery framework, like Help Seeker and Senior Connect, have those had big impacts in our community, or are they kind of still finding their way? Where do those sit?
Through you, Mr. Mayor, to Councillor Oldham, those are great questions. And the Senior Connect app actually had a really great launch with a significant number of people accessing the app, taking the training, and following up with connecting, people who were involved in that, following up, creating a group of that is supporting seniors within the community. That has leveled off a bit. And the Help Seeker app we have struggled with that a little bit. It was a great tool when COVID initially started, and no one knew how to connect with anything. No one knew how to share the information of their services, their changes. So it was a really, really great opportunity to launch that. It is still finding its feet a little bit. We seem to have leveled off with respect to the number of local agencies that have signed up. We did do another push last fall and earlier this year, and we are in a little bit of a holding pattern now to see what the uptake is actually going to be within the community now that things are when things start to settle a little bit. So we are still using it, we are still promoting it, but the information that it provides does give us some indication of where things are at, but it is very small numbers. So 211 is another support, navigation support that we use quite typically as well.
Yeah, thank you for that. Do you think as we've evolved in the last 14 or 15 months and learned so much along the way, that there are kind of windows of time when promoting these ideas? I mean, to promote something now, connecting with your community, is contrary to the public health regulations. So, but as we come out of this and phase hopefully back into greater integration in the community, do you think there's specific initiatives or apps or programs that will create that, in the previous draft recovery framework, the biggest bang for buck and the biggest impact? What do you think those might be as we hopefully, ease into some sense of normalcy over the summer?
Through you, Mr. Mayor, Councillor Oldham, that's a great question. And we are right now in the process of undergoing a program review for FCSS to determine core programs, direction, shifting in terms of how we used to do things versus where are we at now. We've had quite a few staffing changes as well that are helping to bring new skills into the area to take a fresh look at some of the work that's being done. The social planning area as well is shifting and changing and adapting. We're also increasing some of our skill sets there. We're just in the process of finalizing a recruitment for a community and social analyst, investment analyst position. So we know that we are going to be focusing a lot on that community capacity building. So right now we are really focusing on trying to get a strong foundation in place and the right skills in place for that direction forward, and opportunities for those connections. This has been a challenge for us right from the get-go, and I think you really highlighted some of the difficulties. If people aren't allowed to interact, then how do we promote those connections? And we have tried to be really innovative in some of those connections online and virtual opportunities. And some of them have been really successful and some of them just haven't been. And so we're still trying to kind of figure that out.
Great, thank you. One more question. It was impressive to read that there's 159 not-for-profit organizations in Spruce Grove. I'm curious as to your perspective on how the relationship between some of those not-for-profit organizations and FCSS has evolved over the course of 14 or 15 months. Has that model changed at all? And do you see any of that continuing on post-pandemic?
Through Mr. Mayor to Councillor Oldham, another great question. We have really pre-pandemic, and I think you'll remember me coming forward and speaking about some of the changes pre-pandemic that we were being required to make, and that change from a small to that mid-sized city, and how we were engaging with community and why we were engaging with community and having that outcome focus. And we really have made a lot of those shifts. We are trying to be very intentional in where we are spending time and investing so that we can get those high level outcomes for the community. But at the same time, we recognize that, the program level is the on the ground level. So we know that's really important as well. We've really strengthened a lot of the working groups, and I've mentioned a couple of them already, with the Community Winter Emergency Response and the ability of all of these fantastic groups to come together for a really specific purpose and to achieve really important outcomes for vulnerable people in our community. We have had to really think about, when we are sitting at tables, why are we sitting at those tables, and what is the purpose of those tables, and what are they looking for from the city? So we have had to use our discretion for sure, and we'll continue to do so, just because we do need to be really intentional about our time and what we're getting for the community out of that time.
Awesome. Thank you so much for a great response to all those questions. Really appreciate everything you and your team are doing. It's an incredible amount of work and lots to go as we move through the different phases, and really appreciate you being here tonight to share with us what's going on. Thank you so much.
Any other questions or comments? Okay, seeing none, thank you very much, Janine, for the presentation. I think council has pretty much said a lot of thank yous to you and your team and the work that's been going on. I think my first recollection of Project Joy was there was a whole number of people wearing Project Joy t-shirts that were out helping me paint fences last year. I'm serious, like it was Amanda Eileen and Kim Clark and a whole bunch of people were wearing those shirts. So they're super well connected in the community. At any rate, thanks again for the presentation, and thank you for the presentation on what we've done as a city. And there's a big list there, and it's all remarkable. Lots of work behind the scenes. With that, I would ask one of my colleagues on council to make a motion to accept for information report. Councillor McKenzie.
Yes, Mr. Mayor. I'll move that the Spruce Grove COVID-19 Recovery Spring 2021 Progress Report be received as information.
Okay, thank you very much, Councillor McKenzie, for that motion. So with that, I'll call the question on the motion. Okay, thank you very much. That's been carried. And one more motion for this evening. Councillor Stevenson.
Motion to adjourn, Mr. Mayor.
Okay, thank you very much, Councillor Stevenson. Motion to adjourn. I'll call the question on the motion. And good night, everyone. Thanks again. Great committee of the whole.